planted, the placenta as a whole doesn't, it just as in the phases of embryogenesis, then ultimately the placenta grows. Now placenta is connected with the umbilicus, with the mother. Now placenta is located in the uterus. Okay. Then there can be many locations. It can be on the anterior surface of the uterus. It can be on the posterior surface, in the lateral surface of the uterus. And the most thing is that now this location on the internal os, in the margin of the internal os, that is placenta previa. Now that indicates that as the embryo grows into a full-term baby, then what happens? The lower segment of the uterus and the cervix slowly dilates and expands, and there will be from second trimester, there can be spurts of bleeding, and you have to decide now the ultrasonography, USG, you have to decide that how will you manage the case. If it is the life and death, question of life and death of the mother, then you have to terminate. It is related, the placenta is connected with the umbilical cord, with the fetus maternal, and there is placental circulation, then fetal circulation that you've been reading. Now, the placenta, when you are delivering, it might be by LUCS or your normal delivery. Then you have to clamp the maternal side and clamp the fetal side and cut. Now the umbilical cord is cut. Today you just see, and it's a very simple slide. You need not make much tension. Another thing, you draw it today only, and khata kara korecho jama diye dao. Tale I can sign it. Okay, you come by batches. This is the membranes. Here is the umbilical cord. Now you see, you imagine this is the uterus, this is the uterus, this is the baby line. Okay. Now this is the umbilical cord. You see, it is attached here. Now you will be finding that there is in the anterior abdominal wall, there are some anomalies occur. Then that's an exampholus. The thing is swollen, and the membranes are visible, and the intestine is the content of the exampholus. Okay. Now, what we will be seeing is this portion of the placenta in the slide. You see, and this is the umbilical cord slide, and this is the placenta. Then the spine. Now individual vertebra, I made an incision and opened up and cut off, and then took out the brain with the spinal cord without a microscope. And I think no one can show you that. And I presented a paper because you will be reading the brain. Now brain, you see, I showed you, I think In a small class, I will be demonstrating. Now, the brain is at sulci gyri. The few brains which I found had early sulci gyri. So I named them in my speech. I just tell them, is this an Einstein brain, future Einstein brain? But it was aborted by the mother. Spontaneous abortion. You have to think, Umra, only be focused to pass the exam. You be getting 60%. That will be your aim first. Then the finals, you want to do gold medal, you want to achieve anything, you can. It is your choice. Okay, let's see. I'm not cutting this specimen. And next day I'll be showing you if in this thing next week I think there's no classes, I think.